Good afternoon. My name is Christian Summers. I'm a graduating senior biology pre-med major from Dallas, Texas, and today I'm going to talk about my interview with a cancer researcher. So I had the opportunity to interview with Dr. Tina Cascon. She got her MD and PhD from the University of Texas, MD Anderson Cancer Center. I connected with her via email, and I had the chance to meet her back when I lived in Texas in 2013. So I kind of already knew what she was about, and I just got the chance to pick her brain. So I asked her like four questions, and question one was, "Can you tell me about your current work and how long you've been at it?" So, like I said, she's a cancer researcher that's currently studying how immunotherapy can be used to treat lung disease or lung cancer. And she told me she had the opportunity to interact directly with her patients once a week while she's doing her research, conducting her research, and she considers her clinical responsibilities part of the foundation of her career and has been working on a research project designed to better understand how lung cancers can become resistant to a particular type of treatment, immunotherapy. So I then asked her what drove her to choose her career path and what drove her to primarily focus on research in general. So she had a great answer. She was very enthusiastic. She stated while she was in medical school that someone very close to her had developed cancer and died from it, and that basically became the catalyst to drive her to learn as much as possible about the disease. So during her last year of medical school, she became actively involved in research studies designed to identify the factors that determine how patients with different types of cancers in the chest responded to different chemotherapies, or responded to chemotherapies in general. She said that was the defining moment that began to see that the results from her research had the potential to guide therapy and impact patients' lives significantly. So I then asked her what misconceptions do people often have about her work in their field, and she told me it varies, but majority of people believe that you cannot be both a caring physician and a decent scientist because medicine and science require rigorous training and commitment. She said some pure scientists in her field may not consider her a true researcher because her clinical responsibilities and how involved like she is in that, compared to why some clinicians on the other side, when she's conducting research, may think her bedside skills are not sharp enough because she's having to split 50-50 lab research with her clinical research, and she said she spends a lot of time doing lab experiments. She then stated that cancer research and patient care are very complementary and feed off of each other. The results of research that she conducts can have a direct impact on the patients she sees every day, which is obviously true. So I also asked her, what do people under or overvalue about what you do? She said people may undervalue the amount of effort that this profession requires to provide excellent patient care and to more generally advance the field of cancer science. She said changes in the field happen rapidly, so in order to stay current, you need to remain curious and devoted to ongoing study while not losing sight of heart. She states also you need to develop genuine relationships and stick with and then consistently just check up on your patients that have developed cancer or are cancer free, because it just shows you have a true heart and that you really want to impact these people's lives, not just for the pay, but in different ways. You actually want to see them live. You want them to survive from cancer, and you're not just putting them to the side after you take care of them. She said that resonated with her most, and that's why she really loves like this field of being a cancer researcher slash physician, and it's impacted her life significantly. But overall, I felt as if this interview was very informing and significant in what I want to do in my field of in my career. I want to become a pediatric dentist, and I want to change as many lives as possible, not just kids, but I want to impact their lives, their parents' lives. I want to impact lives in general, and I don't want to just be a healthcare professional that just does it for the money. I want to impact people's lives beyond the money. I want to see people recreate. I want to recreate smiles. I want to make people happy to smile again. I want people to enjoy their lives to the fullest without having a character flaw with their teeth. And I just want to impact the youth early. And I want to prevent gum disease, inflammation, cavities, dental cavities. So they don't have to spend a lot of funds on treating themselves, getting their whole mouth recreated when they're like down the line 30 years later. So I'm glad I got this interview, and she really opened up and showed me a side that I really want to see myself doing.